Hi, good afternoon. My name is Aurora, and I'm going to be talking about fluoride in drinking water. Recently, as reported by an article from AP News, federal judge concluded that mounting research points to an unreasonable risk that fluoride in drinking water poses enough risk to merit new EPA regulations due to risk to the intellectual development of children, confirming that many healthcare professionals have been concerned about. This case began in 2017 and it was brought forward by nonprofit environmental advocacy whose name is Food, Water, and Watch. Despite the proceeding being paused in 2020, the judge decided to listen to the lawyer's argument in 2024. The judge wrote, simply put, the risk to health exposure levels in United States drinking water is sufficiently high to trigger regulatory response by the EPA under the federal law. As a research from University of Florida stated, it is the first time a federal judge has made a determination about the neurodevelopmental risks to children of the recommended USA water fluoride level. Currently, the acceptable level of fluoride in the water is 0.7 milligrams per liter of water. Although the judge ordered the EPA to take action, he did not say specifically what steps should be taken. As healthcare providers, we are bound by ethical principles like autonomy and non-maleficence. But water fluoridation removes the ability for people to make an informed choice. The lack of consent in fluoridation violates the core value of respect and transparency in healthcare, especially in nursing practice, where focus on educating and empowering patients to make informed health choices or decisions. I believe Provision 3 of the ANA Code of Ethics is being violated because the population is not being given a choice on a medication that may be harmful to their health. This issue is just not about ethics, though. It is also about health risks. The federal judge ruling heightens concerns about neurotoxicity, especially in pregnant women and infants, and the potential harm to individuals with certain comorbidities like kidney disease. As nurses, we follow the principles of non-malfeasance, of do not harm. If there is evidence that fluoride exposure can harm vulnerable populations, we must ask, why is it still being added to the public water supplies? Additionally, fluoridation disproportionately affects low-income communities, where access to fluoride-free alternatives is limited, raising health equity issues that need urgent attention. Moving forward, it is time we rethink this approach. There are ethical targeted alternatives to mass fluoridation, such as topical fluoride treatments, improving access to better dental care, and promoting nutrition and oral hygiene education. As nurses and healthcare professionals, we have the responsibilities to advocate for policies that respect individual autonomy and prioritize public health. We must ask critical questions. Should people be given a choice about fluoride exposure? What are the potential risks, especially to vulnerable populations? How can we ensure health equity in regards to access to safety or safe drinking water in the population? How can we ensure health equity in regards to access to safety drinking water? And finally, is there a safer, more ethical alternative to fluoridation? These are the questions we need to address in order to ensure our healthcare and ethics. Thank you for listening, and I look forward to your responses. Thank you.